Hi guys, this is Todd with Real Active Wellness. Today I want to share with you something about tongue position. I know that might not sound very applicable to you, but trust me, it is. Tongue position in exercise, particularly in any sort of forward flexion or exercise where there's gravity that's working against your spine, tongue position is really critical. When tongue position is incorrect, it tends to lead to a number of issues. And one of the issues that I want to talk about today is called forward head posture, or FHP. So when the head begins to migrate forward, it's set up for a whole bunch of problems. Here's just a few of them. So sinus, ear, throat problems are really common with people with forward head posture. Any sort of eye distortion, eye discomfort, even digestive symptoms or digestive distress. And probably the most common issue with forward posture is headaches, as well as really tight muscles up here, where we carry our stress, so to speak. So why do we get forward head posture? There's a whole bunch of different reasons why that can happen. It can happen with what's going on at the feet, the pelvis, but today we're going to talk about how the head itself, more specifically inside the head, the tongue, how it plays a role with forward head posture. So one of the things I want you to realize is that the tongue is a muscle, and it's very involved in the stability of the head and neck and shoulder complex. It's critical for symmetry of the neck musculature. So what happens in forward head posture is that when your tongue is not active and you lose stability in your cervical spine, particularly in the upper half of your cervical spine, what happens is you start to recruit other muscles excessively. And the primary muscle that gets overburdened with a lack of good tongue position and tongue work is a muscle called the sternocleidomastoid, or SCM, sternocleidomastoid. And the reason it's called that, I know it's kind of a long word, but it attaches to the sternum right down here and goes up along to the side of the neck and wraps around and attaches to the very back side of the skull back here on some little bony ridges called nuchal lines. But what happens is that when that muscle gets overactive and it begins to have too much tension, which we call hypertonicity, it will pull the lower portion of the neck forward. And of course, you're not going to walk around like this. So the upper portion of the back of the neck will rotate, or the head will rotate like this, so that you can keep your eyes level at the horizon, which is a basic survival reflex, our eyes level at the horizon. So when we do things like sit-ups, as a good example, or planks, even when you're prone, face down, if the tongue is not in the right position, we overactivate the sternocleidomastoid. It projects our head forward and rotates it upward. What's unique about it with forward head posture is that the lower portion of the cervical spine, so think of your throat here, or your hyoid bone, below that will flex forward, but above that, the cervical spine will extend backward. So the more distorted you get in forward head posture, it's not because your neck is bending forward, it's not because your neck is bending backward, it's because it's doing both too much. Lower portion forward, upper portion backward. And again, that sets our body up for a whole number of symptoms and stressors, some of which we already mentioned. So I'll tell you about tongue position and jaw position, and then in the very next video, I'm going to go through a handful. I mean, there's many exercises to help correct this, but I'm going to go through a couple with you and break them down. So if you are the overwhelming majority and you do have some forward head posture, you'll have some ideas on how to fix it. Okay? So tongue position is real simple. When you're doing an exercise such as a sit-up, a plank, something of that nature, where you have some stress put on the head and neck, you want to have the tongue against the roof of the mouth. Where, if you were to swallow right now, where your tongue ends up on the roof of your mouth is where your tongue should be. That provides a physiological reflex that orchestrates the rest of the neck musculature, how to work, when to work, how much to work based on the stressor of the exercise. You will oftentimes see people have lazy musculature here. I'm not talking about excessive fat. I'm just talking about musculature here which drops down and they get that rounding. Those muscles, which are referred to as the suprahyoid above this throat bone, suprahyoid musculature gets weak over time. So if you don't use your tongue the way it's meant to be used, in addition to mastication, chewing, the muscle gets weak like any other muscle. When it gets weak, this one gets overactive, creates forward head posture. So that's where the tongue should be. In addition, the mouth should be closed when you're doing these types of strength training exercises, such again as a sit-up or crunch or something like that. The reason that the mouth should be closed is that when the jaw is slightly clenched and the teeth are connected and you close that loop, it creates a sense of stability, not only for the head, but also for the neck. So that's why tongue position, or at least some of the reasons why, tongue position is really critical when you're exercising, particularly doing strength training. This does not apply for endurance athletes. So if you're running a marathon and you're huffing and puffing for air, you're going to be breathing through your mouth, and that's a different scenario. So I'm talking about strength training, I'm talking about posture, and I'm talking about corrective exercise. That's when this applies. So if you're interested in some of the exercises on how to correct this very common postural distortion, please check in with the next video and I'll show you some of those exercises. Again, this is Todd from Real Active Wellness. Thank you for joining me today. If you have any questions or comments, don't be afraid to hop on Instagram or Facebook at Real Active Wellness. Thanks again.